A 2019 study published in the European Heart Journal followed 15,000 adults and found something shocking about hydration and blood pressure. Those who were chronically underhydrated had 50% higher risk of developing hypertension. But here's what's even more surprising. Drinking too much water at the wrong time can also spike your blood pressure by 20 points or more. Today, we're breaking down the science behind hydration and blood pressure that most doctors don't have time to explain. Let's start with what happens inside your blood vessels when you're dehydrated. Research from the American Journal of Physiology shows that even 2% dehydration increases blood viscosity by 8%. This might sound like a small percentage, but the cardiovascular impact is enormous. Think of your circulatory system like a garden hose. When you're dehydrated, it's like trying to push thicker liquid through the same tubes. Your heart compensates by increasing pressure, but this compensation comes at a cost. Increased workload on your cardiac muscle and elevated stress on arterial walls. Scientists at Harvard Medical School found that blood viscosity changes occur within just 30 minutes of fluid loss. They measured blood flow velocity using ultrasound and discovered that dehydrated participants showed 15% slower blood flow rates, forcing the heart to work significantly harder. But here's the mechanism most people miss. When blood volume drops from dehydration, your kidneys release renin, an enzyme that triggers a cascade leading to vasoconstriction and sodium retention. This is your body's emergency response to maintain blood pressure. This renin-angiotensin-aldosterone system is incredibly powerful. Research from a Mayo Clinic shows that even mild dehydration can increase renin levels by 300%. The downstream effects include constriction of blood vessels, increased sodium retention by the kidneys, and elevated production of aldosterone, all contributing to higher blood pressure. A study in Hypertension Research Journal found that seniors are particularly vulnerable because aging reduces our thirst sensation by up to 40%. You literally don't feel thirsty until you're already significantly dehydrated. This delayed thirst response is due to changes in hypothalamic function and reduced sensitivity of osmolar receptors, the cells that detect changes in blood concentration. The numbers are striking. Researchers found that systolic blood pressure can increase by 10 to 15 millimeters of mercury in seniors who are chronically underhydrated. That's the difference between pre-hypertension and stage 1 hypertension. Even more concerning, a longitudinal study following 8,000 seniors for 5 years found that those with chronic mild dehydration had 23% higher rates of cardiovascular events. Now here's where it gets counterintuitive. Can drinking too much water raise your blood pressure? The answer might surprise you, and the research is fascinating. A 2020 study in the Journal of Clinical Hypertension tracked seniors who drank large volumes of water quickly. Within 30 minutes, their blood pressure spiked significantly. But why does this happen when logic suggests more water should lower blood pressure? The mechanism is fascinating. When you drink a large amount of water quickly, you activate something called the sympathetic nervous system. Your body perceives a sudden volume change as stress and releases norepinephrine and epinephrine, the same hormones released during fight-or-flight response. German researchers at the University of Berlin used advanced monitoring equipment to track real-time blood pressure changes after rapid water consumption. They found that drinking 500 milliliters of water in under 3 minutes activated the sympathetic nervous system within 2 to 3 minutes, leading to immediate vasoconstriction. Research published in Clinical and Experimental Pharmacology found that drinking 500 milliliters of water in under 5 minutes can increase systolic blood pressure by 15 to 20 millimeters of mercury in people over 60. This effect peaks around 30 to 35 minutes after consumption and can last up to 2 hours. But there's another hidden factor that's equally important. Excessive water intake can dilute your electrolytes, particularly sodium and potassium. When electrolyte balance is disrupted, your cardiovascular system struggles to maintain proper pressure regulation. The mechanism here involves osmotic pressure changes. When you drink large amounts of pure water, you create a hypotonic environment in your bloodstream. Your cells begin to swell as water moves from the blood into tissues to balance concentration. This cellular swelling triggers inflammatory responses and stress hormone release. A study from the European Journal of Clinical Nutrition showed that seniors who drank more than 3.5 liters per day had irregular blood pressure patterns and increased cardiovascular events. Interestingly, the same study found that those drinking less than 1.5 liters daily also showed increased cardiovascular risk, highlighting the importance of finding the optimal balance. If you're taking blood pressure medication, this next part is crucial. Research shows that hydration status can affect how your medications work by up to 40%. This interaction is complex and depends on the specific class of medication you're taking. Let's talk about ACE inhibitors first, medications like lisinopril, enalapril, and captopril. A study in clinical pharmacokinetics found that dehydration can concentrate these drugs in your bloodstream, potentially causing blood pressure to drop too low. The mechanism involves reduced kidney function during dehydration, leading to decreased drug clearance. Researchers at Johns Hopkins measured drug levels in dehydrated versus well-hydrated patients taking ACE inhibitors. They found that dehydrated patients had 35% higher drug concentrations in their blood, leading to more frequent episodes of hypotension and dizziness. Diuretics present an even more complex picture. These medications are designed to remove excess fluid, but if you're already dehydrated, they can cause dangerous drops in blood pressure and kidney function. Water pills like hydrochlorothiazide work by blocking sodium reabsorption in the kidneys. But when you're dehydrated, this mechanism can become overactive. A critical study published in the American Journal of Medicine followed 3,200 seniors taking diuretics and found that those who became dehydrated had triple the rate of acute kidney injury compared to well-hydrated patients. The researchers emphasized that diuretic users need consistent, moderate hydration to prevent complications. Research from the Journal of the American Geriatric Society followed 5,000 seniors and found that those who maintained consistent, moderate hydration had 30% fewer medication-related side effects. This included fewer episodes of dizziness, falls, and emergency room visits related to blood pressure medications. Beta blockers like metoprolol, atenolol, and propranolol can also be affected by hydration status. When you're dehydrated, your heart rate increases to compensate for reduced blood volume, working against the medication's intended effect of slowing heart rate and reducing cardiac workload. Italian researchers studied the interaction between hydration and beta blockers in 1,500 patients. They found that dehydrated patients required 20% higher doses to achieve the same blood pressure control as well-hydrated patients. Here's a critical finding from pharmacology research. The timing of water intake relative to medication matters enormously. Taking BP medications with inadequate water can reduce absorption by up to 25%. The pills need sufficient fluid to dissolve properly and be absorbed through the intestinal wall. But drinking excessive water within 2 hours of taking certain medications can dilute stomach acid and affect drug dissolution. Extended-release formulations are particularly sensitive to this effect, as they rely on specific pH conditions to release medication at the correct rate. Water alone isn't the complete story. The Framingham Heart Study, which followed participants for over 50 years, identified electrolyte balance as crucial for blood pressure regulation in seniors. This landmark research provides some of our most reliable data on cardiovascular health. Sodium gets all the attention in blood pressure discussions, but potassium is equally important. Research in Hypertension Journal shows that the sodium to potassium ratio matters more than absolute sodium intake. The ideal ratio is approximately 1 to 2, meaning you should consume twice as much potassium as sodium. When you're properly hydrated, your kidneys can efficiently regulate this balance through sophisticated filtering mechanisms. But chronic dehydration impairs kidney function, making electrolyte management more difficult. Dehydrated kidneys become less efficient at excreting excess sodium and retaining potassium. A fascinating study from the American Journal of Clinical Nutrition found that seniors who maintained optimal hydration needed 20% less blood pressure medication to achieve target readings. The researchers followed participants for 18 months and found that proper hydration improved medication effectiveness across all drug classes. Magnesium is the third player most people ignore. Research shows that dehydration reduces magnesium absorption in the intestines and increases magnesium loss through the kidneys. Magnesium deficiency is linked to resistant hypertension, high blood pressure that doesn't respond well to medication. Studies from the University of South Carolina found that magnesium levels drop by 12% within 24 hours of becoming dehydrated. Since magnesium is essential for proper muscle function and blood vessel walls, this deficiency contributes to increased vascular resistance and higher blood pressure. The DASH diet studies revealed something important. When participants maintained proper hydration alongside the diet, blood pressure improvements were 40% greater than with diet changes alone. The DASH researchers noted that hydration amplified the beneficial effects of increased potassium and reduced sodium intake. Based on all this research, here's what the science tells us about optimal hydration for blood pressure management. First, the timing strategy. Studies show that spreading water intake evenly throughout the day maintains stable blood volume. Research suggests 6 to 8 ounces every 2 hours works better than large amounts infrequently. This steady intake prevents the blood volume fluctuations that trigger pressure changes. Circadian rhythm research shows that our cardiovascular system follows predictable patterns throughout the day. Blood pressure naturally rises in the morning and falls in the evening. Hydration timing can work with these natural rhythms rather than against them. Second, the medication timing protocol. Clinical studies indicate taking blood pressure medications with 6 to 8 ounces of room temperature water optimizes absorption without causing pressure spikes. This amount provides sufficient fluid for dissolution while avoiding sympathetic nervous system activation. Pharmacokinetic studies show that taking medications with the optimal amount of water can improve bioavailability, the amount of drug that reaches your bloodstream, by up to 30%. Third, the electrolyte consideration. Research from the New England Journal of Medicine shows that adding a pinch of sea salt and potassium-rich foods to your hydration routine can improve blood pressure stability. But this must be balanced carefully, especially if you're on sodium restrictions. Temperature matters too. A study in the European Journal of Applied Physiology found that room temperature water causes less sympathetic nervous system activation than very cold water. Ice cold water can trigger a stress response that temporarily raises blood pressure and heart rate. The quality factor. Research shows that water with natural minerals supports better electrolyte balance than distilled water. Minerals like calcium and magnesium in natural water contribute to cardiovascular health. Monitoring is crucial. Studies suggest checking your urine color. Pale yellow indicates optimal hydration without overloading your system. Dark yellow suggests dehydration, while completely clear may indicate overhydration. Here's the breakthrough finding I promised at the beginning. Recent research from Johns Hopkins followed 2,000 seniors with hypertension and discovered something remarkable. Those who followed a hydration prescription, specific amounts at specific times coordinated with their medications, saw average blood pressure reductions of 12/8 mmHg. That's equivalent to adding another blood pressure medication, but achieved through optimized hydration alone. The key was consistency and timing, not just quantity. This personalized approach to hydration is now being called chronohydration, timing your water intake to support your body's natural rhythms and medication schedule. The most shocking part? 80% of participants were able to reduce their medication dosage under medical supervision while maintaining better blood pressure control. This represents a paradigm shift in how we think about blood pressure management. The research is clear. Hydration and blood pressure are intimately connected, especially as we age. The science shows us that it's not just about drinking more or less water. It's about drinking smarter, with attention to timing, quantity, and quality. Remember, always consult your healthcare provider before making changes to your medication routine or hydration habits. The studies we discussed today provide the foundation for informed conversations with your medical team. What surprised you most about the hydration-blood pressure connection? Share your thoughts below and subscribe for more evidence-based health insights.